everyone. This is Rochelle Seeger. I'm with the Foundation for a Healthy Kentucky. Thank you so much for joining us here today on this important webinar on health systems and services. We have a great lineup of speakers for you here today on our Shifting Helping Responses COVID-19 and the opportunities it's presenting us. As I mentioned, I'm with the Foundation for a Healthy Kentucky. The Foundation's mission is to address the unmet health needs of Kentuckians. The Foundation does this by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. A reminder for today's webinar, the webinar is being recorded. You'll have access to the recording and the slide deck from today's webinar later today or this week. Also, please feel free to chat in your questions to us if you're on the computer side of things. Those questions come directly to the presenters here today, and we'll also have time on today's webinar to answer your questions that you send to the presenters. I'll send out a message in just a moment. If you're having audio problems, one way is to reduce the burden on your computer, so maybe you can shut down some tabs that you have open or other computer programs that you may have running, or I'll also send around a phone line, so if you have problems with the computer side, you can dial in and listen to the audio via a phone line. I'll send that out in just a moment. The Foundation for Healthy Kentucky's website, healthy-ky.org, has all of our information about our current work and our current strategic plan, past reports, events, upcoming things, news releases, and also on that website you can sign up for the Foundation's e-newsletter. You can do that at healthy-ky.org. Another announcement, the Foundation for Healthy Kentucky started the Coalition for a Smoke-Free Tomorrow, and that has its own website, smokefreetomorrow.org, and you can learn more about the policy work they're doing to reduce tobacco use in Kentucky. You can sign up for their newsletter and learn more about joining that organization at smokefreetomorrow.org. I also want to mention that the Foundation has a Health Policy Champion Award. That's where you can nominate your colleagues in Kentucky or nominate yourself. We welcome self-nominations for Health Policy Champion Award. The picture on the screen is Mark Carter, Dr. Sheila Schuster, CEO of the Foundation for Healthy Kentucky, Ben Chandler, and LaChrista Finn, part of our Community Advisory Committee, awarding Dr. Schuster last year the award at our 2019 Boast Health Policy Forum. You can find nomination forms and all the information on the website healthy-ky.org on the About Us tab. Also upcoming on the Foundation's schedule of events, next month will be the annual Boast Health Policy Forum. Naturally, that will be all online, so please check out the Events tab, Boast Health Policy Forum, to join us for that free Health Policy Forum, which will begin next month in September. A few more announcements before we get started. Also, when you go to the website to learn more about the work of the Foundation for a Healthy Kentucky, you can also learn about the Community Advisory Council. The Foundation's Community Advisory Council is part of the founding of the organization, and it's people from across Kentucky who are advising the work of the Foundation. And we are looking for folks to join that advisory council. We're looking for different types of people, and specifically people who live in the area development districts of Buffalo Trace, Fiveco, Gateway, and Cumberland Valley. You can check out the website to learn more about the work of the council, how to nominate yourself or others, and this is an important part of joining the work of the Foundation if you're interested, so please check that out as well. I was talking census earlier today with a colleague in Pike County, and I do want to remind everyone on the call that the 2020 census is happening now. Kentucky nonprofits have done great work, and folks probably on this call have done great work about getting out the count for a fair and accurate 2020 census. That is happening now. If you haven't shared the information with your colleagues, friends, and neighbors, please encourage everyone to participate in the census. Kentucky Nonprofit Network put up a great website, KentuckyNonprofits.org, Census 2020, with information that you can share. with your friends and colleagues or in your newsletter. And also the 2020 U.S. Census Bureau has information on their site, 2020census.gov partners, important for all of us. And if you need more information about the census, please feel free to contact me. But again, we're here for the Health for a Change webinar series. This series started in 2011, and the foundation puts this on free of charge to participants. Typically, it's in-person workshops and webinars, but here you're just hearing our great voices and over the internet today. It's a great opportunity to connect with people in Kentucky who are doing great things, to learn more, to hone our skills, and we have a great list of presenters here for you today. All of the archives of past Health for a Change events are posted to the website on the Foundation's website, Events tab, Health for a Change, and the recordings of prior events. I welcome your ideas for future Health for a Change training topics. But it is all about partnerships. I'm honored to have worked with and met so many great people across Kentucky who are doing work to improve the health of Kentuckians, like the Kentucky Center for Smoke-Free Policy, the Kane Community Kitchen in Whitesburg, Kentucky, our free public libraries, Jessica Bellamy and the Root Causes Research Project, and many, many others. So I thank them for their partnership and for joining us on these webinars today. Just like the partnership that you'll hear about today, I'm thrilled to have all the presenters here with us, and I'm glad to turn the call over to April with Pyre, who will be leading the panelists today. Welcome, April.
Thank you, Rochelle. I do want to echo your introduction. Thank you, everyone on the line, for joining us today for this webinar on shifting helping responses. COVID-19 is an opportunity to increase collaboration and streamline services. Today, we're going to be discussing how COVID-19 has impacted service provision in several Kentucky nonprofits. To start, we'll introduce our speakers, including myself, and the partner organizations that we're working with. We also want to describe some of the many faceted issues facing individuals and women, particularly in Kentucky. To address these concerns, we will also cover a cooperative agreement that has leveraged federal funding and other means to enhance cooperation and provide more coordinated intimate partner violence and HIV services, even as the COVID-19 stay-at-home orders interrupted face-to-face services and may continue to do so for who knows how long at this point. We want to hold space for a panel discussion with our partners on this agreement, as well as a domestic service provider from Lexington, so we're representing 2 major metropolitan areas in Kentucky. Before we get started, first and foremost, thank you so much to the Foundation for a Healthy Kentucky for hosting this webinar today. And we also want to acknowledge the funder of our collaborative agreement that made this webinar possible, the Office on Women's Health. Through the Advancing System Improvements for Key Issues in Women's Health funding opportunity, we were funded under Preventing HIV Infection in Women through Expanded Intimate Partner Violence Prevention, Screening, and Response Services. And by we, I mean the Center for Women and Families in Louisville, Volunteers of America Mid-States, and the Pacific Institute for Research and Evaluation, or PIRE. My name is April Schweinhardt. I'm an Associate Research Scientist at the Pacific Institute for Research and Evaluation, PIRE, and we have an office in Louisville as well as several other locations throughout the country. I am the project director for our cooperative agreement with the Office on Women's Health, which brought together the Center for Women and Families and Volunteers of America in this cooperative agreement. The reason we came together was to tackle the complex issues of substance use, mental health, HIV, and intimate partner violence in our community. Next, I'm going to hand it over to our speakers one by one to introduce themselves, starting with Arlene Grullon.
Hey there, folks. My name is Arlene Grullon. I'm the Director of Emergency Shelter Operations at the Center for Women and Families. So what does that mean or look like? Right, it's kind of a mouthful, but basically it varies day to day. Definitely includes lots of meetings and planning sessions. A lot of our work requires us to stay current so that we continue to meet the folks that we serve where they're at. But it also includes plunging toilets, There's coaching staff. When we're working with traumatized individuals, we usually encounter some, I guess you would call, typical situations, but there are definitely a lot of nuances when we're working with people. And I find myself oftentimes explaining how to navigate TARC and its challenges. I'm actually a New Yorker myself, so I feel like I'm highly skilled at public transit. I also feel like I, hopefully with some regularity, work on understanding and interpreting the needs of the folks we serve, and that our services meet those needs. As far as the center, so the center is a dual service provider. We serve 7 counties in Kentucky, so that includes Jefferson here, Shelby, Bullitt, Spencer, Oldham, Trumbull, Henry, and I think I got all of those. And then we also serve 2 counties in southern Indiana, which are Floyd and Clark. And a lot of the work that we do consists around prevention work. So we meet with individuals in community spaces, in schools, and hospitals to educate around intimate partner violence, sexual assault, consent, and just overview of our services. And then the rest of the work that we do consists around crisis management. So we present at the we show up at the hospital if someone discloses they've experienced either intimate partner violence or sexual assault. We support individuals through the protective order process at court. We provide emergency shelter for individuals who are at high risk of death. And we also have a 24-hour crisis line. So it's kind of what the center does, and I'll hand it off over to Marissa.
Thank you, Arlene. My name is Marissa Waters. I'm a senior HIV prevention specialist with Volunteers of America Mid-States. So I'm part of the HIV services team, and we are focused on providing free HIV testing. We do outreach, education. And so what that looks like is we provide free anonymous HIV testing. It's a rapid test, so individuals can come to us, get tested, get their results right away. We do free linkage to care, so anybody who tests positive, we are with them step by step until they are established in care and make sure that they get what they need. We do PrEP referrals, the pre-exposure prophylaxis medication, that 1 pill a day to prevent HIV. Offer free safer sex supplies, so we distribute condoms, lubricant, and the like. We do that can provide those to individuals, or if you're an organization who would like some and to distribute out to your clients, you can reach out to us and get that. And then we also do education, so offering educational programming on HIV and sexual health courses. So if you're interested in any of those services, please reach out via email, amarissaw@voamid.com, mid.org, or at our website, voamid.org/HIV. And I will go ahead and pass it on to Darlene.
Oh, good afternoon, everyone, and thank you for joining us for lunch. And thinking about intimate partner violence might be hard, but it's well worth it to realize the challenges that are happening amongst us. I'm Darlene Thomas. I am the Executive Director for Greenhouse 17, which serves 17 counties in central Kentucky. And I'm not going to name all of those, but it is the 16 surrounding counties, 8 of which are Appalachian communities, and many rural communities, and then, of course, Lexington. We do that in a variety of ways, so not to be repetitive, but the primary service we provide is emergency shelter. That's kind of the core of this work. I've been doing this work for 30 years, and the work grew from a very grassroots movement, and so shelter's core of what we do across the state at all of the shelters, but we've grown. We realize that shelter's not enough. It's not the answer. So we provide shelter and court advocacy and different forms of legal advocacy to all survivors. We have counseling, support groups that take place. We have major community partners, so many community partners to make referral, because we're not in this mission alone by any means. And it is really our goal is to meet people where they are, each survivor where they are, very individualized approach, and then to engage not just the survivors in their own journey, but the community in that journey to understand that we're all kind of in this together, not to sound cheesy, but I'm going to go with our governor on this one, in the sense that intimate partner violence affects us all. My particular role, wow, it's been so many things over the years, but, probably to be the leader, I guess, for our region, to bring voice, to lobby, to educate. I do lots of training. My job is to stand with systems, but also challenge systems to make sure that the voice of survivors are not forgotten. We're predominantly intimate partner violence. We have our sister program in Lexington as well that serves rape crisis, or provides rape crisis services. So we partner in many ways to make sure the needs of survivors are being met. That's pretty much who we are. Thank you.
Hi, everyone. I'm Ashley Simons-Rudolph, also at PIRE. I'm facilitating the discussion today, the Q&A, and that ability is now open. So please feel free to write in any questions that you have for our panelists.
Thanks, Ashley. I do want to set the stage for our panel discussion. Today I'll be discussing some of the complex issues facing individuals in Kentucky. And as Darlene said, these are important to everyone and affect us all. So just to put some things in context, nationally, Louisville and parts of eastern Kentucky are above average for new HIV cases and current HIV rates, as well as IPV and domestic violence, IPV, intimate partner violence. In fact, Kentucky has 54 of the 220 counties nationwide identified as most vulnerable to HIV outbreaks. In the last 10 years, Kentucky has also seen an increase in domestic violence reporting, and domestic violence service providers have reported that one of the number one reasons survivors seek treatment is related to substance use. Besides our current pandemic, COVID-19, Kentucky is also at the center of the opioid epidemic, with some of the highest prescribing rates in the nation. These problems are complicated even further by other social determinants of health challenging Kentuckians, including low socioeconomic status, low educational attainment, high levels of obesity, high levels of infant mortality, and also high levels of smoking. We're unfortunately ranked close to last in many of these crucial areas of health, and these also include our unemployment rate, poverty rate, and workforce participation and wages. And this is even before our pandemic affected all of those things clearly. In our work, we have found that the most at risk for HIV may not be being screened or accessing help for HIV testing, pre-exposure prophylaxis, PrEP, or related services, because by speaking to service providers themselves, we also found that the current service provision situation, so the situation amongst service providers, is not well equipped to address these intersecting issues. So we have violence, substance use, HIV, and all the mental health concerns that go along with them. All these barriers facing survivors when attempting to access services then lead to also fear, stigma, shame, and other feelings related to cultural and ethnic differences that are additional barriers to seeking help. So discussing these complex issues necessarily introduces the idea of intersectionality. While it was originally introduced as the intersection of multiple social categorizations, we should also consider the experiences of an individual and how their mental, physical, and emotional health can put them at a disadvantage when it comes to those other social determinants of health that we talked about. Many studies have indicated that the overlap of violence, substance use, and mental health issues is as high as 70%. So one individual experiencing all those things is as high as 70%. And of all these concerns, they together put individuals at an increased risk for HIV as well. The numbers vary because of methodological differences in studies. Most people have wider or narrower definitions of what it means to experience violence, assault, rape, serious mental illness, substance use. And the definition of substance use has changed in the recent past, especially when it comes to coercion, which plays a big role in intimate partner violence. It's also important to consider multiple other factors that figure into these equations. So developmental and other childhood experiences, cultural and social experiences, both positive and negative, the marginalization and structural oppression that comes with that, supports available to individuals or the lack thereof, and then, as I mentioned on the previous slide, barriers in seeking assistance for all of these things: mental health, substance use, violence, assault, and the intersection of them. So PIRE and the Center for Women and Families in Louisville worked together previously to help support survivors at the intersection of substance use, intimate partner violence, and mental health concerns. We found that over time there were many of these barriers to implementing a plan to be more comprehensive in the services delivered to these clients. Bringing people together was difficult. We had limited funding. There was red tape, federal limitations, all kinds of things. So we learned the lesson that cross-sectional work is important and doable, but it takes a lot of time. And facilitation is helpful, but relying on federal or outside sources for facilitation, it really just took too much time and slowed down our progress. We were able to achieve a mission, vision, and strategic plan to address the intersection of substance use, mental health, and violence, but we weren't able to actually implement any of our plans in the time allotted. So we saw another opportunity to work cross-sectionally, and in this case, we brought in Volunteers of America in this current cooperative agreement, ensuring that PIRE, as the research partner, could provide facilitation and kind of handle the logistics of everything, while the service providers could focus on service provision. This made it easier to establish memorandums of understanding, collaboration action plans, all the things that we needed to ensure that the process moved forward within the first few months of our project to facilitate working together. And it also helped the project to continue in the context of COVID-19 when that really hit in March. So we started by asking service providers how all these different factors that I've been talking about affect their work with clients. And here's what we heard. We heard that substances are used as a source of control and coercion in intimate partner violence relationships, that shame is induced by the abuser or the perpetrator regarding substance use as well as HIV, which can keep someone locked into a violent relationship. Sexual safety concerns regarding sexual control and coercion can increase HIV risk. Substance use is often used as a coping mechanism for both violence or HIV and other mental health concerns. And then substance use increases the risk of HIV by putting the user in a dangerous state, both at risk from sharing needles and then also a dangerous state for violence to occur. So all of these things we heard from service providers who have experience with this population of clients. Now I'm going to turn it over to our panel discussion, which includes a representative from each of our partner organizations, as well as Darlene Thomas from Greenhouse 17 in Lexington, to talk about these concerns. Ashley?
Okay, thank you, April. Let's start the panel discussion by telling us the status of your agency in terms of its response to COVID-19. Arlene, why don't you get us started?
Sure. So currently, when COVID started, the infamous March Friday the 13th, our response was pretty immediate, but in terms of trying to figure out logistics and protocols, a lot of time was spent just meeting and problem-solving space within staff and with clients in shelter and clients in the different spaces that we were meeting. And so wherever we could, we went virtual as soon as possible. And as of now, we've returned to in-person services, actually as of June 1st. And so for the most part, our services in Indiana are up and running, although a lot of the work that we do in schools is on pause because of school being virtual. Our services in the hospitals where we advocate for folks is in person, which, is a lot to navigate given that our hospitals are oftentimes kind of ground zero for COVID. Court advocacy continues to be partial, in person and virtual, which oftentimes presents some challenges for trying to get folks the protection they need, but also managing their safety in that process. And then our shelter is currently at reduced occupancy, but we continue to also serve clients in hotels. And our crisis call volume seems to be ebbing and flowing kind of based on the governor's orders. So at the height or the start of COVID, the call volumes were really high and people were just really fearful and concerned and had a lot of questions. And then in the thick of COVID, the call volume went down, which was worrisome for us and, particularly because of what we are learning and know to be true, right, that folks are feeling trapped or are trapped because their perpetrators are telling them that they can't leave or that they're going to get sick or that, things aren't open for them to seek help. And so those calls felt, the ones that were coming through were as staff shared longer and the safety planning was far more intense than usual. And so right now that's kind of where we're at the moment, what we're managing at the center. So I'll pass it over to Marissa.
Yeah, at Volunteers of America HIV Services, we also are functioning in a more limited capacity. So back in March, we had all testing and outreach services suspended in order to kind of restructure how we did things and put together a comprehensive plan so that we could provide HIV testing while also ensuring client safety from COVID. So doing research to develop that plan and then actually physical changes to our office. So when individuals come to get tested, we can do work to keep them safe. So as of June, we have started our testing in office. It's by appointment only, so you can go to our website to get an appointment. So we offer testing Monday, Wednesday, and Friday currently in office. And we just recently got approved to restart community-based testing. We've had to, we've been working closely with the Kentucky State Health Department with our plans to get back in the community. And so we're adapting our comprehensive plan for the specific spaces that we're working to get back to the community. And then throughout this, we've continued to supply safer sex supplies. So we've just adjusted how we do that. So we provide curbside pickup so individuals can come by and we'll bring them out to them. We do mail order now, so you can actually, again, go to our website and order condoms and get them mailed straight to your house. And then we are continuing to drop off the more bulk supplies to our community partners we work with so that they can continue to distribute those resources. So I'll go ahead and pass it on to Darlene.
Hi, well, I just have a few things to add. Arlene and I, we're sister programs. So working with the state coalition, we all tried to collectively, the 15 programs across the state, to make sure that we were responding to the best needs of our the folks we were serving, as well as the staff that provide those services. So we did the same thing, basically, and still are. We're probably a little slower I've moved a little slower to kind of reintegrate or do in-person work. So much, except in the courts. So we are in the courts where the courts allow us to be, and we worked really hard to ensure that we were allowed to be in courts during the whole COVID-19 response, as long as courts were having protective order hearings so that survivors didn't have to face courts, that system without some advocacy present. We still are running, we're over capacity, but half are in actually the shelter, the other half are in a hotel. You know, we're doing a lot of screening. Those that are health compromised, we're working quickly. We might put them in a hotel, but working quickly to try to get them independent, safe housing out of a hotel so that they're kind of back on their own and able to isolate. You know, we're taking as many precautions as we know to do and following the lead of our leadership, our health department, our local collaboratives that are looking how to best shelter individuals who are homeless or intimate partner violence victims. So we're kind of ebbing and flowing and moving really slow to get back together. The way we try to reach out to survivors have been multiple ways, but we are still doing a lot of virtual work, virtual support groups, daily phone contact with individuals. And I totally agree with Arlene. It's crisis calls have ebbed and flowed, and for a little bit of time there, it was pretty scary because we were not hearing from survivors. So we reacted by trying to create, or we created locally in the Lexington area, a document for all of our providers to send out to all their constituents that helps how do you support survivors as a friend or a family member or who you're afraid might be survivors. So we're hopeful that that helped reach out to a lot of individuals. And I guess like everybody else, we're figuring it out as we go with always safety. And the most challenging thing for me, I'll be honest, is how you keep people safe from intimate partner violence and COVID-19 all at the same time and deal with multiple issues that they're having to face and need resources for in many areas where there's no resources available because it's shut down. The only part that we had to shut down for Greenhouse 17 was visitation and exchange, which we were worried about because those are our kiddos. But that, as of June 1st as well, has reopened, and that is our main in-person service at the time. Thank you all.
Thank you. Thank you, panelists. Now, representing VOA, I'd like Marissa to start with the following question. In what ways did you see COVID-19 impact your clients?
I think the biggest way was the not having easy access to free rapid HIV testing, which I think is an essential service, but it was essential for us to kind of take a beat and figure out how can we continue to provide this service and keep people safe. And so, you know, doing that through our programming, but there was that period where free HIV testing was not easily available in the city in terms of the rapid community-based testing. So what this means is individuals we were less likely to reach those individuals living with HIV who are unaware of their status, and those who are unaware of their status are unlikely to have easy access for testing, because the model that we have used is really working to meet people where they are, doing at-home tests, doing community-based tests, doing mobile testing, and all of that had to stop. And we've only are slowly starting to get back to some of our services. And, you know, individuals who are living with HIV unaware of their status, not having easy access to testing can result in later detection for those folks and later initiation of treatment. So we've been working really hard to collaborate with the state health department. We're checking in and making open communication with the Louisville Health Department so that we're sharing information and what services they're able to offer, and so that we can do referrals if we're not reaching folks. But then another way folks have been affected has been limited access to safer sex supplies. So a big way that we distribute is through providing bulk quantities to different businesses and organizations, and a lot of those businesses and organizations were shut down as part of the stay-at-home orders. And so, you know, really, again, needing to rethink how we approach things. Thank you.
Okay, thanks very much. Darlene, what do you see, in what ways do you see COVID-19 impacting your clients? I know you spoke on this a bit before. Would you like to expand on that?
Well, yeah, just a little bit. I think the biggest impact for survivors, other than the fact they were isolated with their partners that put them in probably the greatest danger we've seen, even statistically. Since March, there's been 15 domestic violence murders. We typically have 23 to 28 a year. So in 4 or 5 months, the trend is not looking good with COVID-19. So you have the impact of the isolation. But I think the biggest issue for them was the either misinformation or misinterpreted information that was coming out everywhere. It was that the courts are closed or the courthouse closed, and so people perceived they couldn't get protective orders, or if they called the police weren't transporting. So even if you called, even if you could get help, there was nowhere to go. They heard shelters were closing or at limited capacities, or I would get stuck in a hotel, or I don't know where it would be or how I would get there. And I think that lack, because nobody had ever prepared ourselves for anything like this, just a lack of information or how it was misinterpreted, especially through the courts. So many survivors that finally called for help truly believed that the courts were closed and you couldn't get a protective order. So I do think those were barriers. I think we learned lessons on how to do that better, which I'm sure we'll address, but that's what I would have to add. Thank you.
Okay, thank you. Arlene?
Yeah, so I would definitely echo a lot of what Darlene shared, and add that I would say in shelter, some of the just kind of major changes that I think are just impacting folks, whether they're in your own homes or out in the community, is just the overall universal precautions. So just clients trying to again, just maintain the distancing, wearing masks, making sure that, as an agency, we're also keeping up with the cleanliness of things. I've had clients share, that wearing masks is really challenging because it feels like they're suffocating. And for some of our clients, that's a reality. It's a re-traumatizing reality. A lot of them mention just, the quarantining if they are symptomatic. Again, just brings up, feeling trapped in a room, feeling controlled and isolation. And then overall for a lot of our clients in general, and again, the public at large, right, where COVID is just impacting people's mental health, and for our clients who, are seeking safety, it's further impacting their mental health. Folks who are experiencing or substance use disorder, depending on if they're quarantined or where they're at, could be going through withdrawals actively, and so working with staff and with clients around safety planning around that. And then for our kids and just, particularly ones in shelter where it's already hard to be in shelter, right, they didn't choose to be there, and so not being in school, parents trying to navigate maintaining their employment, and there not being child care, or the individual that was their child care person now is someone who may be highly health compromised. And so those are the things I would add that are definitely impacting our clients.
Thank you, Arlene, for highlighting some of the challenges at the Center for Women and Families. I would like to ask now, in what ways did you adapt service provision to account for stay-at-home orders? Darlene, would you like to start off?
Well, we're still adapting constantly. Again, we created the ways to reach out. We used a whole lot more. I was doing weekly updates. The Facebook, we have a lot of former survivors and survivors that are Facebook friends and Twitter and other social media, where we were trying to get as much information out as how to get access to us or to services, how to do that safely, how to be careful with technology and the use of technology for survivors who might need assistance and help, and things to look for in their partners, and then trying to help family and friends. It was just such a new world of trying to envision. We were behind. I'll be honest, I was not ready for the technology needed to have access. Now we moved pretty quickly and we got some help, and we used our sister programs to help teach it. We kind of taught each other what to do and work together, but we finally got up to speed with virtual communication with substance abuse for all of our survivors in shelter. We have a peer support person. We were able to connect them more virtually. We're working on currently to do crisis calls via text. But our biggest response was to communicate as much as possible through social media, connecting survivors, and then putting some pieces into place where we would have better access for those in the hotel and for those just in the community through virtual support. Thank you.
Thanks, Darlene. Arlene, back to you. In what ways did you adapt service provision in order to account for stay-at-home orders at CWF?
I would say similar to Darlene. I feel like I actually took a lot of pointers from what Darlene was doing at some point in the beginning of this mayhem. I would say that our big phrase is endless pivoting. I feel like that's all we do. And so, again, similar to what Darlene shared, just at the start of this, where we're figuring out spacing, and then individuals during our anticipated peak, figuring out how we created further space. And so folks that were working or had regular doctor's appointments, we put in a hotel. And so for our agency, we actually quarantined individuals for 4 weeks, which was pretty challenging. That required us to be checking in on, basically we had 2 shelters. And so we were checking in on folks in hotels. We were also worried about being away from staff. Although we were checking on them in person and over the phone, it still feels very different than being in the building. And then individuals in the building were having a hard time being trapped in the building. And I think staff were heavily impacted, right, because, there's just constant, protocols that we're adjusting to and trying to remember to do things at the right time, or communicating what needed to be done. We were doing temp checks, and we continue to do temp checks multiple times in a day, meal times. I mean, just a lot of different logistics that I feel like now we're fairly well versed in, but, it's just a lot of little, very important things to remember all the time.
Thanks. How about VOA, Marissa?
To echo Darlene, we adapted and we're continuing to adapt. And I think, pretty early on, I think we kind of realized the way that we had done, the community-based work where we would really go out and be at fairs, at different events to reach folks. It's going to be a long time before we can do that kind of stuff again. So there's this realization that we really need to rethink the way that we reach people and connect with folks. And so we've done a lot of work shifting education to be more online and accessible digitally. And so been working to redo our curriculum, the curricula that we have for different courses and education programs that we would normally go and provide in person, developing those as webinars and Facebook Live educational events. And so really thinking of the ways that we can use the digital resources that exist to connect with folks. And then we do provide a service that is essential for folks. So really working with within state, federal, and, all the CDC restrictions and guidelines to develop a plan that keeps people safe so that they can access the services, utilizing the PPE and constructing our office spaces to incorporate plexiglass barriers and cleaning protocols and COVID screening. So really working to research and understand what is needed to adapt, and then doing that work to get us there. So while we didn't have testing available, our staff were working at home and working on these different projects, rethinking outreach materials, so developing COVID prevention packs. So we have hand sanitizer mask packs that have our information on it that we're working to provide to different community partners and individuals in the community so that folks are getting what they need, and to help them keep safe from COVID while also getting the information about our services. So, and then again, mail order condoms, curbside pickup for those, and really working to connect with organizations to see how we can work together to get clients what they need.
Okay, thank you so much, panelists. It's time now to turn to the Q&A session. Again, I would like to encourage anyone who has a question to write it in now. It's a great time to get excellent advice or the experiences of practitioners who've really been on the ground and working through COVID-19. So we do have one question, which was about the address. So we have an attendee who is interested in the address to receive condoms through the mail. And I just wanted to open that up to you, Amarissa, if you could share that. And if everyone who's interested might want to get out a paper and pencil or something to write it down, that would be great. So Amarissa, what is that address to request condoms by mail?
Yes, so you just go to our website, which is voamid.org/HIV. And once you are there, there's actually a button for schedule your HIV test now. So not the best, clearest thing, but you click on that, and then it's the very first option that you can order condoms to go, either mail order or curbside. And what I can also do is, Ashley, I'll share this with you so you can post it in that the question box so that folks have it that way as well. And if you have any questions, feel free to reach out to me as well via email.
Wonderful. Thank you, Amarissa. While we're waiting for some more questions to come in, I have a question for the panelists, and that is that in the media I'm seeing how COVID-19 is hurting people of color in particular, also those with fewer socioeconomic resources and others who are struggling in our communities. So I'm curious what your organization has done to reach out to these communities in particular and what you've learned through those experiences. So I will open it up. Arlene, would you like to go first?
Sure. So I think as some of my colleagues mentioned, at the center, part of our reaching out to folks in the community is definitely utilizing social media. Our CEO, Elizabeth Wessels-Martin, also has done a lot of interviews and just communications with the media at large, letting folks know, for one, that we're open, because I think that seems to be kind of the biggest challenge, is that people don't realize that we're open or how they can reach us. And then I would add that we've done some virtual spaces, some of which we're calling couch sessions, where we've connected with community members, similar to something like this, where we're talking about different topics and how the work that we do and the people that we serve and all that's going on in our city and the country is impacting us. And so from that, we've learned some of what I think we know is that, there's a lot of systemic change that's problematic, or systemic issues that are problematic. And so figuring out those in the community that we can collaborate with to work on how to dismantle those systems. Not to speak like super abstract, but a lot of it, for one, has to do with us doing some work internally as an agency, so that we can really support the communities that need us most. And so yeah, it's an ongoing struggle.
Thank you, Arlene, for that really poignant answer. Marissa, what are you seeing from a VOA perspective?
Well, similar to Arlene, as an organization, Volunteers of America Mid-States has been working to come together to do that more institutional work that needs to be done so that we're not perpetuating the harms of systemic racism and really working against them. But then just generally are more focused around the HIV services. People of color are disproportionately affected by HIV. So reaching those individuals has been a priority for us. But since COVID, it's just made it more complicated. And so, a big strategy of ours is working to meet people where they are, but now we have to work to meet people where they are in a way that is focused around safety from COVID-19. And so ways that we've been working to do that is, again, these kind of COVID prevention packs that has our information on it so that we can spread the word about what we're doing, that we're back providing testing, and then taking it down to the protest to provide to individuals down there, taking it out into the community, and then, again, providing it to organizations within the community for them to provide to their clients. We're a priority of ours now that we've been approved to restart community-based testing is to really focus on those areas where it's individuals who are those who are disproportionately affected by HIV. So working to get back at our regular testing at the NIA Center, which is down at 29th and Broadway. In terms of really thinking about helping individuals who are also struggling because of the effects of COVID, and so working to provide incentive-based testing when we're able, which, providing gift cards to encourage folks to get tested, but then that also really provides help for a much needed access to resources. And then again, also thinking through how can we spread the word by providing resources that are really needed by community members. And so working to rethink our outreach within the context of COVID.
Thank you, Marissa. That sounds really comprehensive. We got a great question, which is, what do other health providers, many of whom might be on this call right now or watching later, need to do to support and improve your work? So Darlene, we haven't heard from you in a while. Would you like to take the first pass at this? Again, what do other health providers need to do to support and improve your work?
That's a great question. And so I'm going to give it's complex, but I'm going to give the simple answer. I need all healthcare providers to look at everybody that comes before them as potentially a victim of intimate partner violence, despite any bias that any of us may carry about gender or race or faith or anything. When I train and teach people, I always say, anytime you have a picture of what you think a victim may look like or how they may dress is about the time you're going to be wrong, and then we jeopardize people's safety. So I'm going to say assess for all and believe and know that anybody sitting before us could be a survivor. So we need to assess, we need to ask the questions and provide the referrals and the guidance and the support that reduces the stigma and the isolation that comes with victimization so that we can connect them to the appropriate services. So that's my long and short, although we could do this for 3 hours and a whole other seminar, but I do think that's the most important thing health professionals can do is assess. Don't be afraid to ask questions and get people connected, and don't assume who's a victim and who's not. That's one way.
Don't be afraid to ask questions. Don't assume who's a victim and who is not. That's really good advice. Arlene, to kind of close us out, what would you add to what Darlene has said?
That's spot on, Darlene. I would add just believing people. I think that sometimes folks get caught up on maybe trying to figure out what the truth is, and the fact of the matter is that nobody's expected to play detective, and how somebody presents because of one incident that occurred to them is going to be different for the next person. And so ask questions, and really at the end of the day, when in doubt, just refer people to the services that they say they need or that you think may be helpful, and asking people permission to do that, I think, is really important. Yeah.
Okay, thank you. What would you like to add, Marissa?
Yeah, I think, our work works best when we do it in collaboration with others. So we would love to work with very different community partners in the city. If we're not already working with you, reach out and we will get connected. But I think one thing that can really help with getting folks to get tested for HIV, to know their status, is really educating folks on that HIV is a different disease than it was in the 80s. It's a chronic disease. Treatment works. People live long, healthy lives with HIV. And so it's just so important that everybody do regular testing, and so that those who need it can get connected to that treatment. And so any ways that we can help support your all's organizations and connect with you all to get that message out, we love collaborating with folks. Thank you.
Thank you. And thank you so much for your questions that you sent in. I'm going to turn this now back to April with Pyre.
Thanks, Ashley, and thanks to all of our panelists, as well as everyone on the line. Thank you for attending. If you have any questions, you can feel free to reach out to me. My email is up here on the screen, aschweinhart@pyre.org. I did want to give a little bit of a shout out. We have a community advisory board on our project that we are looking to grow. So if you know or if you are a female with lived experience with intimate partner violence and or HIV, please feel free to reach out to me and contact me to join our community advisory board, because we would love to hear from you. Secondly, I want to give a little shout out. Ashley and I will be presenting at the National Coalition Against Domestic Violence, their 19th annual conference in October. This will be a virtual presentation, so you can register for the virtual conference and hear our presentation. We are proposing a collaboration action plan as a first step to build relationships and share a community vision that extends beyond that of any single service agency. So it's part of the project that we presented here today, and we'll be talking about how collaboration action plans are one way to address the complex needs of survivors by translating our desire to work together into an actionable reality. These are distinct from MOUs or strategic plans that are often rigid and developed by leaders. A collaboration action plan is more flexible, and it's important to have the input of service providers with lived experience. So just a little shout out there, and I'll hand it back to Rochelle.
Thanks, everyone. This is, again, Rochelle Seeger with the Foundation for a Healthy Kentucky, and I will be emailing everyone an evaluation survey. That's an online survey. I would love to get your feedback about today's webinar. Average, it takes participants about 3 minutes. If you would share that with me, and I do welcome your recommendations for future training series, topics, speakers in this webinar series. That's how we got today's fantastic presenters to share all their information, ideas, and critical connections on this topic here today. So thank you. Your ideas are welcome. Rochelle Seeger, I'm honored to work here at the Foundation for a Healthy Kentucky. I love to connect people across Kentucky who are doing work to improve the health of Kentuckians, and this is a very important topic we covered today. I was nodding and saying yes when my line was on mute, so thank you again to our presenters for sharing this information, because improving health for all Kentuckians is all of our jobs, and I thank you for all of you who are doing this work across our state. This concludes today's webinar. Thank you for joining us.